Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Breast implant surgeries play a pivotal role in helping you become the most authentic version of yourself. Tailored to accentuate your feminine contours, these procedures not only enhance your physical appearance but also bestow a profound sense of self assuredness and body positivity. So, if you are on the brink of gender transition or simply intrigued by the empowering potential of breast implant surgeries in gender transformations, this discussion is your gateway to exploring possibilities, fueling your curiosity, and embarking on a remarkable journey towards self discovery and authenticity. Welcome, everyone. I'm Dr. Samya Saluja from THIP Media, and today, to help us understand the role of breast implants better, we have with us Dr. Aditya Narayan Choudhary. Dr. Aditya, a highly proficient and dedicated plastic surgeon who is presently associated with the Heritage Institute of Medical Sciences in Varanasi. He began his professional journey as a senior resident at Banaras Hindu University, where he refined his abilities and gathered priceless expertise. He did his hair transplant training under distinguished Dr. Manoj Khanna in Kolkata and learned facial aesthetic procedures at M.S. Ramaiah, Bangalore. Dr. Aditya continued to improve his skills while working at the prestigious Rajiv Gandhi Cancer Institute and Research Center. Additionally, he has worked as a visiting senior consultant at Pristine Care. Dr. Aditya's impressive expertise includes a broad range of plastic, aesthetic, and reconstructive surgical procedures. Dr. Aditya, THIP Media welcomes you, sir.
Hi, ma'am. How are you?
I'm fine, sir. And thank you so much for joining us today. So, Dr. Aditya, gender affirmation or transformation, it is a life-changing decision. So, I'm going to start off this discussion by asking that can breast implant surgery aid in aligning an individual's physical appearance with their gender identity?
Definitely, ma'am. It can be a component of gender affirming procedures. There are various procedures that patients undergo to align to their gender identity. For example, in trans feminine individuals, these are those individuals who are assigned a male sex at birth but identify themselves as females. Breast
Right.
augmentation can help create a more feminine chest contour, which
Okay.
can contribute to a greater sense of gender congruence. But
Right.
here I must point out that it is very important to note that not all transgender individuals pursue the same procedures. And so,
Okay.
decision with regards to such surgeries may should be made in consultation with healthcare professionals who specialize in transgender healthcare, rather than
Right.
going on whims and fancies or chasing the social norms as we see on social media and the other platforms.
So you've just mentioned about the breast augmentation procedures for trans feminine patients. So my next question would be somewhat associated with that. That what distinguishes breast implants used in gender affirmation surgeries from those which are used in regular cosmetic breast implant or breast augmentation surgeries?
Ma'am, so material-wise, they are more or less similar, but then
Okay.
there are certain differences in the procedure and our, as in surgeon's approach to the procedure. For
Okay.
example, there are saline implants, there are silicone implants, but
Right.
in gender affirmation surgeries, the main goal is to create breasts that are proportionate to individuals' gender identity and body frame. That
Right.
is, we aim for a natural and a feminine appearance. Whereas in the cosmetic surgery, the goal is to enhance the breast shape or size based on patient's preference
Okay.
without specific focus on gender identity. Similarly, for a transgender individual, when they decide to undergo this surgery, we have to take them through a thorough psychological evaluation to ensure that the surgery aligns with their gender identity. And
Okay.
then, anatomy wise, also, while performing surgeries on these people, uh, for example, there are differences in chest size. A narrower chest may require a different kind of an implant, or we may need to position the nipple areola complex. So that needs to be taken care of. Whereas these are not major concerns in cosmetic surgeries.
Okay.
Also, these it is important to emphasize that each individual, they come with their specific needs. So we have to
Right.
cater to those needs. And in this case, more than surgical, the needs are emotional and mental to a certain
Okay.
extent.
Right.
So we have to be sensitive towards that.
Right. So what I read is that the breast implant surgery for gender affirmation procedures, it necessitates a very individualistic approach that is primary concerned with that has actually to do with their emotional health. Just extending to that part, you just mentioned about the types of implants. So I would just like to ask that what different types of breast implants are available for gender affirmation surgery, and what are their advantages and disadvantages?
So, ma'am, the two basic main categorization that has been done is the saline implants and the silicone implants. So, the saline implants, they have the advantages that we can inflate them in varying amounts of saline. So, the shape can be changed intraoperatively and also postoperatively. Also,
Right.
since they are not already inflated, we can place them through smaller incisions. They have
Okay.
a very low cost as compared to the silicone implant. But then there are certain disadvantages that come with them, like they feel less natural than the silicone implants. In
Okay.
some patients, there is risk of rupture because they are not as sturdy. Then there is potential for visible rippling. For example, in very thin individuals, the edges of these implants can be visible, which gives it a
Okay.
more of an artificial look. It
Okay.
does not look natural. On the
Okay.
other hand, the silicone implants, they look and feel more natural. There is
Okay.
low risk of this rippling and low risk of rupture, but then they are very costly. We use
Okay.
we have to use larger incisions to place these implants, so the scar marks for surgery uh, are possibly more visible for these. And then they come in a fixed size, so you cannot alter the size. For example, if I order a 250 ml implant, and on table I feel that I can go for a higher volume implant like 280 ml or 300 ml, that cannot be
Okay.
changed at that time.
Okay.
And further, the silicone implants are also classified based on several factors. For example, the filling material. It can be simply gel based, or they can have a structured silicone inside. The shapes can vary. For example, the most commonly used implants are round. They are the previous
Okay.
generation implants with which we have various studies. But nowadays, teardrop shaped implants have come, which resemble the slope of a natural breast. Then the
Okay.
texture of these implants can be smooth or textured to these. So when there is a smooth texture, the scar on the outside of the implant has a tendency to grow very strong. So
Okay.
when these implants are textured, it can reduce the risk of capsular contracture.
Okay.
Also, they can be classified on the basis of profile. For example, if a patient wants greater projection, so we have
Okay.
profiles based on that: low profile, moderate profile, high profile, and then there are certain coatings which are done to more or less get the similar results.
So you've just mentioned about the larger incisions and the scarring that could be probably visible in case of silicone implants. So just an extension to that particular statement, that what is the typical recovery process for individuals undergoing these breast implants, especially for gender affirming procedures?
So, ma'am, right after the procedure, since the operation takes place in general anesthesia, so the patient will usually wake up in the recovery area of the hospital room. Then there
Right.
will be pain and discomfort. That is obviously manageable by pain medications. Then there are
Okay.
drainage tubes in place to remove excess fluids that forms post surgery. Then
Okay.
arm movement is restricted to minimize the strain on incisions. In
Okay.
the first week following that, the swelling, bruising, and discomfort will be the maximum.
Okay.
Patients will need to wear supportive bras or compression garments, and they'll have to avoid strenuous activities.
Okay.
Then, in the second week, all this starts to subside. Patients are able to return to light activities. They continue wearing the pressure garments, and then they
Okay.
start following a gentle stretching and range of motion exercise routine, which is
Mm.
still not proper exercise. Then,
Okay.
from third week to sixth week, the swelling usually subsides in most of the patients. Patients resume light exercises. The
Mhm.
incisions begin to heal. Obviously, the scarring is still visible, and they continue to wear the supportive garments. Now, from
Okay.
second to sixth month, the final results begin to appear when the edema has subsided. The scars usually start to fade in this time, and it is very important that in this time the patient follow up their appointments religiously so that very basic things like scar and all this can be managed to give a very better appearance. As far
Okay.
as the management part on our side is concerned, most patients can return to light activities in 2 weeks. For
Mm-hmm.
scar care, we use certain gels and silicone sheets so that
Okay.
we can diminish it to the maximum possible extent as per patient's physiology. Long-term care definitely is needed. Patients need to come and visit us. It helps in monitoring the implant's integrity and overall breast health also. Apart from them, the most important topic and the most important point of concern that we discussed earlier was the emotional control. So these people
Right.
need to have a social support network. It
Okay.
could be consisting of us, their family, their friends, or probably best if all of us are involved in the process, and
Okay.
access to mental health resources if needed.
Right. So we just manage the recovery phase of the breast implants. What about the potential risks which are associated with these surgeries? And can you explain what this breast implant illness is in this context?
Definitely. So, like any other surgical procedure, there are certain risks and complications. For example, there's risk of infection. So, we usually put the patients on antibiotics to avoid that. Then there's
Okay.
risk of capsular contracture. So, what happens is the scar around this implant it contracts, as a result of which the implant becomes hard or the shape tends to get distorted. So, revision
Right.
surgeries are usually needed to correct this. Then there
Okay.
can be risk of implant rupture or leakage in case of trauma or rough handling. Then
Okay.
certain individuals they complain of change in sensation in their breasts, right, which
Okay.
is totally normal. But in
Mm-hmm.
certain cases, there is hypersensitivity, which has been seen to extend for longer periods of time.
Okay.
Then, in certain cases, we see implant migration. It moves or shifts, which leads to uneven appearance. It's very
Okay.
unnatural look. And then,
Okay.
obviously, there is scarring, which is a part concern for the patient.
Mm-hmm.
As far as breast implant illness is concerned, ma'am, it is very controversial topic and not very widely recognized. So it is said that certain individuals who undergo breast implant procedure, they have reported symptoms like fatigue, joint pain, memory problems, which they attribute to the implants. But there is
Okay.
very limited scientific evidence to establish the direct link between these two entities.
Okay.
As far as corrective options are concerned for these complications, so
Mm-hmm.
some patients do need to go for implant removal because they are very
Okay.
much bothered by these complications. Some
Correct.
patients, as their body ages and changes, they choose to go for implant replacement. Some even go
Okay.
for breast revision surgeries for asymmetry or migration. So it is very important to discuss all this with the patient beforehand so that they are not
Okay.
pushed into a domain where they're very uncomfortable.
Right. So are there any other options available apart from breast implants to achieve these desired changes in the chest or the breast area during a gender transformation surgery?
Ma'am, depending upon the extent of change that we are
Right.
hoping for, there are certain options like we can augment breasts with fat transfer. So we
Okay.
liposuction the fat out of abdomen and other fatty areas, and we can use
Okay.
that same fat to change the breast size or to enhance volume.
Right.
Then there are
Right.
certain negative pressure or vacuum devices known as Brava devices, which are worn
Okay.
like brassiers, and they
Mm-hmm.
help in enlarge the breast size over a certain period of time.
Okay.
Then there are various top surgery options. For example, once you've undergone the breast implant surgery and then
Right.
there is marginal visibility or then there is scarring. So what we can do is we can hide these margins using the fat from other areas. Uh,
Okay.
there can be chest contouring for individuals that seek subtle changes through
Okay.
liposuction or tissue reduction. And then obviously there is hormone therapy, which is
Mm-hmm.
known to increase or change breast size by 1 or 2 cup size in certain individuals.
So one very important question that I would want all our listeners to understand are the do's and the don'ts for ensuring the long-term well-being and durability of these breast implants.
So obviously, let's start with the do's. So you have to go for regular follow-up. You cannot avoid that. That is a must with any surgery, I guess. So
Right.
then self-examinations are very important in this case.
Okay.
So patient is usually the first person to come to know or to detect any changes in the breast, be it any
Okay.
abnormality, be it any mass. So self-examination is very important. Then we have certain screening modalities like mammograms, which are nothing but breast X-rays. Then
Hmm.
we can schedule these mammograms according to the age to see if
Okay.
any other changes are occurring in the breast. Then
Okay.
there is we prescribe patients to do regular massaging of the breast. which
Okay.
have undergone implant procedure. This reduces the risk of capsular contracture. So the
Okay.
scar that forms is relatively soft and easy to manage. Then these
Right.
patients have to maintain a healthy lifestyle. So if they undergo serious or wide changes in body weight or any other aspects as regards to their lifestyle,
Mhm.
the appearance gets affected. So they'll not be
Okay.
very happy with the results. For example, if they gain a lot of weight, the implant
Right.
will not be as permanent. Or if they lose a lot of weight, then this implant will not have adequate support and will tend to brestosis. So these
Okay.
are certain areas that we have to take care of. Don'ts, as far as don'ts are concerned, obviously avoid trauma, avoid rough handling. Any activities that could result in chest injury have to be avoided. Then we suggest the patients to avoid smoking because it increases the risks of complication and affects the healing process a lot. Then we also suggest them to avoid using illegal drugs.
Okay.
They should not undergo any unapproved procedures without
Okay.
knowledge of the primary surgeon. And also, they should not skip any follow.
Okay.
Last and most important is ignore any changes. So if the patients see or feel any changes in the breast, for example, pain or asymmetry or changes in shape or texture, they should promptly report these to the surgeon. They should not
Right.
neglect these.
Right. So, Dr. Aditya, we really appreciate you being here with us today. And I'm hoping that this discussion will help them embrace their journey of self discovery with unwavering confidence. Thank you so much for joining us today.
Thanks a lot, ma'am, for having me.
Okay. Thank you so much. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.